and welcome back to another episode of Healthspan Horizons. As always, I'm Melissa. I'm here with Jasmine, and today we have a very special guest, Tom Lawry. Tom, thanks for joining us today.
Well, you're welcome. It's great to be with you. It looks like you're a little house on the prairie with that log cabin in the background.
I know we're venturing out of our normal backgrounds today, so it's summertime. We're in the boonies of Canada today. So,
All
Tom,
right.
where are you based out of?
I'm based out of Seattle.
Oh, so a little dreary, but hopefully not as hot as it is everywhere else right now.
No, it's a great place to be in the summer.
Yeah. Well, Jasmine and I know you. We know your background and everything like that, but I'd love for you to introduce yourself to our audience. Tell us who you are, what you do, or what you're famous for, et cetera, et cetera.
Okay. Well, again, Tom Lawry, currently managing director of Second Century Tech, which is an advisory firm based out of Seattle. I'm also the author of the best-selling book Hacking Healthcare, which is all about use of AI to basically help fix a lot of things that are not as good as they should be in health and medicine. Recovering Microsoft executive. I was previously the National Director of Artificial Intelligence for Health and Life Sciences at Microsoft. Prior to that, I was the Director of Worldwide Health, which meant I got to do a lot of really great analytic and AI projects. 80% of my work was actually with health organizations outside the United States. So I've had the privilege of working around the world on a lot of advanced analytics and AI projects with a lot of brilliant clinical and health leaders trying to make healthcare better. So that's what I do.
I love it. I feel like, and I'm not going to say you're like the OG of AI in healthcare, but like kind of. You are one of the original AIs. And we've actually been talking a lot about this in the last couple of weeks about there's a lot of buzz of what's happening with AI in healthcare. Is it going to change things? Is it systemic? Things like that. So I'm excited to dive into that as we
Well,
progress
good.
later
Me too.
today. So, all right. So, I kind of wanted to, since we're talking about your background, I wanted to jump in and kind of see how you got interested in this, especially having done it for so long. I feel like it's a little bit of a niche to be like, oh yeah, I want to use artificial intelligence in healthcare. So how did you get there? What was your journey to this?
Well, in some ways, I've always been in and around healthcare. I'm not a clinician, but I started life actually as a healthcare executive running hospitals and health systems in America. The genesis for me is I've always believed healthcare is a very noble cause, and certainly, particularly here in the United States, has a lot of things that aren't working as well as they should. So, I guess my journey started years ago when, as a healthcare executive, I was always a big believer in the use of data to make decisions. This was way before we had the kind of computing power, or even the cloud was not even on the horizon. But I was always someone who used data to try and help make decisions on, improving performance. So it kind of started there. I left a perfectly good career running healthcare organizations to start a couple of venture-backed startups in the dot-com era. And so at the time, we were looking at how to use things like the internet to do some of the first early patient engagement experiences. From there, I rolled into a second company that was doing some things that mainly related to business intelligence at the time, which was the new thing. So business intelligence kind of kept growing. Eventually, we got into advanced analytics, and then eventually, probably 12 years ago, we started seeing a whole lot more happening when it comes to machine learning and things we could actually bring into the real world instead of just the laboratory to do good. So, it was about then that I became part of Microsoft's first healthcare incubation group. We were doing a lot. It was one of the best jobs I've ever had, where you kind of got to be a mad scientist and experiment with a lot of things. So, that kind of brought me to the fact that I was at Microsoft 15 years and left about a year ago. So I've been fortunate to follow the evolution of both healthcare and then the use of these increasingly powerful tools to try and bring those two together to make healthcare better.
That's amazing that you basically saw the full kind of inception of the beginning to just kind of experimenting to actually seeing it come to fruition as actual usable services. And I guess before we get into the actual more deep diving on what AI is actually doing in healthcare, how would you say that your experience at Microsoft actually influenced your views on the intersection of technology and healthcare? Because that's a very specific place to come from, and then especially at this, we're in like Web3 and decentralization, which is kind of like the other side kind of thing. So just wondering what you think of all that.
Well, I failed to mention, I mean, I've been privileged to work for, I think, two of the best companies in the world. So I started out actually working at GE Healthcare, um, great organization. And then, I was actually looking at getting ready to start another venture-backed company when Microsoft created the incubation group. So I figured, gosh, I'd just come along and work for them instead of raising money to start another company. But I mean, Microsoft's been, I think, on the vanguard of advanced analytics, AI in the cloud, before others. And, there are some other great big companies, but, Microsoft is a place where, they do an amazing job of innovation. They have a culture of really, you know, having others look at, how do we take technology, push it to the edge, and not for the sake of technology, but rather for the sake of making the world a better place. If you, go and just look at the mission statement, particularly under Satya Nadella's leadership, at the end of the day, I mean, they're there to increase shareholder value, but they do that by trying to optimize the way everyone works across all industries. So I just, I got to hang out with some super smart people. I had the opportunity to be working with, some of Microsoft's top health and medical clients around the world. And, I get a lot of credit for being a quote AI expert, but so much of what I learned was just the privilege and opportunity of parachuting into great medical centers and research centers and just working alongside of people who were trying to solve big problems. And along the way, we figured out how to use data and how to create software to make that better.
Awesome. Yeah, I mean, I think sometimes, we can kind of get into these paradigms where it's like, these are the bad guys, the big tech, the big pharma, and all that kind of thing, and we sort of forget that there's actual individuals behind that, and that's why it's so great, just the way that we can all interconnect and meet up and see that there's bright, intelligent, and humanitarian people across all of these different companies and fields, and lots of people are actually in this, for those reasons and wanting to actually make the world a better place, and that we really have to focus on the flaws in the system itself rather than kind of like pointing at individuals. So that's really cool. Um,
Well said.
I guess next, so I would, what are the most significant advancements that AI has brought to healthcare in the recent years, would you say?
Boy, Jasmine, that's a very broad question. Well, let's just back picking up on the story. So, I look back and I was just looking at this as part of a talk track I'm doing for a keynote I'm doing in Singapore in a couple of weeks, where early on, some of the first places we started seeing the use of AI actually doing good in health and medicine was, our growing capabilities to use things like machine learning to predict things. So, again, back in the United States, 12 years ago or so, some of the first things we started doing is looking at, well, how do we use machine learning to predict which patients that are being discharged from a hospital are likely to bounce back with basically a readmission that could be prevented. And I won't bore you with the backstory, but there was a change in reimbursement in America where if I discharged an inpatient sicker and quicker just to get them out the door, there was a higher likelihood they'd come back for a readmission because I pushed them out too early. So, the ability to predict which patients would likely come back and then put some type of, case planning on it, discharge planning to reduce that was clearly a win when it comes to quality, clearly a win of, what patient would really want to bounce back to another hospital stay that they didn't want to be in there in the first place. So we started seeing a lot in machine learning, and if I could predict who's going to be coming back for a readmission, I could also predict things like which patient's likely to have the greatest likelihood of a fall, the greatest likelihood of a hospital-acquired infection, the greatest likelihood of fill in the blank. And then we evolved, and we started seeing really cool things like, vision AI reaching human parity, voice AI reaching human parity. And then we started applying those things. And, I look at, and a lot of, I look at, the good work of what you were doing in the longevity space. And, I start seeing things like the ability to apply a lot of those tools to do things like hopefully reduce that difference between lifespan, which is how long we live, and health span, which is the quality of life. And finally, to finish this longer than expected soliloquy, in the fall of 2022, this thing called large language models and Gen AI came screaming at everyone. I mean, we all were working on certain things in the lab, and then all of a sudden, OpenAI and ChatGPT came at us. It's interesting to me to note in the fall of 2022, ChatGPT hit 100 million users in 2 months. Nothing in the history of humankind as a product or solution has ever come close to that when it comes to adoption rates. And so that set us off on a whole new track that we've been chasing for a year and a half, almost 2 years. And I'd finally say, the really cool, interesting thing that sometimes makes people a little crazy about AI is we have no idea what's going to come at us in the next year. So as great as Gen AI has been, it's not to say that we won't see these other breakthroughs coming at us. Maybe not at the speed and velocity of change we've been seeing, but I mean, AI is constantly evolving. And so for those of us who are kind of adrenaline junkies that love not knowing where something's going is pretty cool. For those who like a predictable world, it's causing a little tension.
I agree. I feel like we actually talked about this earlier this week on like a Twitter space about the use of the massive adoption of AI and basically how people, we'll say economists, business professionals are predicting the decline of AI and at least the like buzz and hype about it in the next little while, because it's kind of had its mass adoption and now everyone's kind of realizing that it can't do everything that people said that it would. So with that, I'm going to put that as like the background. I would love to hear your own personal thoughts on that, but I wanted to kind of pull in like what do you feel are the challenges in adopting AI into healthcare? Do you think that there will be a time where it not necessarily replaces doctors, or do you think that there's going to be has to be a systemic reconstruction in order for that to really happen?
Well, first of all, Melissa, there were at least 12 questions in what you
I know,
just.
I just realized that. So take what you will
So,
and leave it.
how long is this podcast? No, let me see if I can parse some of that. What's interesting is, that, again, if you look at the history of AI, which goes back at least until, I mean, really cool things started happening, actually, in the mid 1900s. But over time, it's become kind of a shiny object, and then we refer to it as, and then we've had AI deserts that we go into where everyone gets excited. It doesn't meet up to all of the hype and the expectations, and then it cools off. I don't believe that's going to happen now. I think, if anything, what we've seen with particularly the advent of large language models, Gen AI, things like ChatGPT, is this. Everyone's been focused on it. So if you look back, any article you're reading today or you're hearing a news report, the first question to ask is, are they talking about general AI or are they talking about Gen AI? And chances are they're talking about what's the latest shiny object. So, and it has been a shiny object. And it's amazing to me how, in being a shiny object, everyone's trying to shoehorn their own agendas into AI. So, I've been doing AI for at least 15 years, working with brilliant people, learning from brilliant people. But I don't go around calling myself an AI expert. We're all early in the journey. It's constantly changing. I feel like I'm always a student because it's constantly changing. So, but I've at least got 15 years I can point to projects and working. It's amazing to me how many people are now out there, particularly online, calling themselves AI experts when they have opinions and they have a product they may want to sell. But if you really get them talking about what they've actually done with AI and projects, particularly in health and medicine on use cases, you find that there are a lot of people talking, but again, we're all early in their journey, and there's a whole lot more to come. So I'm hoping that we're going to start seeing we're going to start squeezing out the hype. We're going to start squeezing out the people who are positioning as quote experts, because they have an agenda. They want to sell you something. They want to do something, and I'm looking forward to the time where it's less of a shiny object. I'm hoping something else is going to come along. Maybe it's the metaverse, where all of a sudden everyone's keen on that, and we can just get back to doing good work with these increasingly powerful tools to make health and medicine better.
Yeah, I mean, I really think that the Gen AI speaks to a lot of people because of how kind of relatable it is. And I mean, the way that I see it, I mean, we love ChatGPT here and all the generative solutions because it does make work easier. It makes mundane tasks a lot quicker. And I think that's really the key strength of it is just the auto kind of, yeah, like the way I describe it is that it makes Google search work the way you always wanted it to when you first ever tried it. um, but yeah, I mean, there's definitely so many different types of AI, and I mean, Rejuve, like we also are leveraging many types, not only large language models. So that being said, what impact do you think that AI will have on the patient outcomes and personalized medicine and perhaps extending health span as you were kind of alluding to, and how much of that will be LLM based or other techniques perhaps?
Yeah, well, again, 12 questions in one. Thank you. I'm going to start my answer there by coming back to something I didn't address with what Melissa said in her 12 questions. So it's interesting to me how, we're still seeing the chatter around AI being an existential threat to humans. The narrative of how so many people are going to lose their jobs. And for example, in health and medicine, I mean, think about this. The majority of people, whether you're a doctor, a nurse, a revenue cycle specialist, the majority of the workforce in healthcare are knowledge workers. So, for those types of work that are non-knowledge workers, highly repetitive activities, low variance in what they do, those are the roles that have some likelihood of being automated either out of existence, or there will be fewer of those. But again, healthcare is a preponderance of knowledge workers. So when I see people writing articles about should we be training as many radiologists as we do, that immediately tells me two things. They don't understand what AI is really good at, and they probably don't understand what a specialist like a radiologist actually does. So, one of the most important things to understand about AI is to understand the concept of how it adds value. AI adds value only in one of two ways for any industry, but particularly health and medicine. One, it automates something. And this comes back to something that's work that's highly repetitive, low variance, not a lot of thinking needed. Those are the kind of things that AI process automation are good at. But so much of the work, let's go back to physicians, nurses, others, it's knowledge workers. And the second way it adds value, it augments the work done by humans. And so I do a whole talk track on, understanding that AI, I mean, the cool thing about AI is I mean, the human brain is so amazing that we started outsourcing things previously only the human brain can do, which is what we call AI. And so that's where, things like pattern recognition and massive amounts of data. AI is better than humans at finding patterns in massive amounts of data. Um, and so that's a benefit. But then humans are uniquely good at everything from wisdom, judgment, experience, problem solving, creativity. Think about the care process, making a diagnosis, making treatment recommendations. It involves both things. And the idea is, how do I take everything AI is good at, better than humans, and bring it in behind the knowledge workers to make them better at the things they care about, at the things they do? So that's the value prop. That's where we have the ability to do things like, a lot of studies that show many physicians spend more time doing administrivia than they do seeing patients and practicing medicine. So our ability to have AI lower those highly repetitive activities on things like documentation, the time they spend in EMRs, frees them up to do more things, to be better doctors, or do things like have more free time to do research or get home for dinner with their family. So that's the value prop. But it's interesting to me how many people who are experts um, can't explain the value prop, which then says it's very difficult then to take AI, bring it in behind humans and work processes to make them better at everything from patient care to more efficient operation of these very complex systems we call healthcare.
I I agree. I'll try to stick with one question from now on. I just got so excited while we were talking, and I was like, "Oh my
That's
gosh, I
fine.
was thinking about this." So this is not on our questions, but I was curious from your experience, like how well or how successful have you seen AI be integrated into healthcare systems? Have you seen? I don't know what Microsoft has done. Have you worked with specific hospitals and tried to implement things, or how, or it's just theoretical? Or tell me about your experience with that.
Yeah, well, yeah, great question. And again, I'm a broken record. Everyone's early in the journey. There are times where I get to work with brilliant people who have what I call AI envy. Somehow they think other organizations, other groups are so far ahead, and most organizations are not. We're early in the journey, and we're all kind of figuring this out and learning together. Having said that, it's interesting to me, particularly post-pandemic, where it's a safe assumption to say any major health and medical organization today is using some form of AI. And the real question is, while everyone's using it, very few, in my experience and the data I see, are actually getting value at scale across the enterprise. And so the big question for everyone to assess is, why is that? Everyone's using it, but few are getting that value at scale across the organization in service of their mission and their clinical goals. And my belief is this. AI is technology that empowers people to do things like process improvement and process change. The technology doesn't drive change. The process is driven by people and processes and willingness to change. So, many organizations that I go into, they're all excited about AI, and they're showing me, a use case or two that actually got published. And if I come back 2 years from now and they're telling me about the same kind of sorry use cases 2 years later, that tells me that there's a lack of what I call the leadership imperative in healthcare organizations, which is to say, value at scale comes from things like what are you doing to upskill your entire workforce, not just hire some data scientists and have a really good CTO. What are you doing to bring along all of your clinicians, everyone in the organization when it comes to things like digital upskilling? Because the greatest factor when it comes to resistance and that value at scale is making sure the workforce understands what's happening, making sure they're part of that whole thing on process change. Things like I've rarely met a healthcare executive that says anything other than we're innovative. And even as a math guy, and it's like, think about a bell-shaped curve. How can everyone possibly be innovative? And some are more innovative than others. Some of that's leadership. Some of that also is, is innovation something that you're building into your culture? Because everyone loves to talk about innovation, but most humans hate change. So there's this whole tier of, I've got kind of the leadership checklist that I work with people on to say it starts with good leadership. It starts by doing more than having AI as a slogan. We're going to be great at AI, and a lot more about that thoughtful process of bringing your workforce along, looking at, the very best people when it comes to ideas for the use of AI are not data scientists. They're the floor nurses out there on the front lines. They are the physicians sitting in the operating theater lounge between cases saying, if only there was a better way to do, fill in the blank. Those are the people that have the best ideas. Those are the people I want to talk to because they're the ones that will drive the most change at scale. So get them involved, have a process across the organization. That's where you drive value at scale. Don't do that. You're going to be talking about the same use cases that you just put out today, 2 years from now. It won't be driving value at scale, which is to say you won't be getting that return on value and return on investment that you thought you would have in the use of AI.
This is honestly, it's so interesting to me how many people I've realized in my own life are resistant to change, as you were talking about, with the integration of trying to put some sort of automation into any of their systems. Even like my husband's a dentist, and they've been trying to integrate some more with their patient charting and stuff at the office. And the girls, it's been a huge effort to get people on board because it's scary and it's new and it's hard to adapt to at the beginning. And I agree. I think it comes from like the leadership being like, hey, we have to do this. This is going to make all our lives better. This is going to make a difference. And if you don't, then it's easy to just be like, yeah, we're going to do it, and then just have it fall to the wayside for sure.
Well, and that's where when you treat AI as a technology initiative, you will most likely fail, or you won't achieve the potential you're capable of. And again, I'm big on this, where oftentimes I talk about how AI has a PR problem. AI is not about technology. Done right, AI is about empowerment. It's about empowering physicians, nurses, consumers. But it's about empowerment. But empowerment, again, some technology driving process change, driving good design thinking to say, if something is not working, how do we envision a better way of doing something? And once you do all of that, then you can start looking at, well, how might AI play a role? When you start out with AI in search of something, that's usually not the best starting point.
You're definitely dropping all of the wisdom nuggets as far as, for instance, leadership, startup organization, and all of that, product market fit. And it really resonated too. And you were talking about, that it has to be part of the culture. Like in Rejuve, like I call it the 360 initiative, where it's like no matter what role you're in, whether you're, the graphic designer or an AI developer, like everyone should have a holistic understanding of what we are doing and why. Even if it's not it doesn't have to be a super technical level. It can be on everybody's own frame of reference. But as long as we all have like this shared vision and motion. So I guess shifting just a little bit. So a lot of people have kind of concerns about ethics when it comes to AI. It's kind of a big subject. What do you see as or do you see it as a high concern for the use of AI in healthcare, or any more and above what we already have, just with the system as is?
Yeah, great question. The short answer is yes, I have a lot of concerns. The longer answer is, but done right, I believe AI has the ability to actually reduce and mitigate many of the biases and injustices of the current healthcare system. So, what I start by saying is, unfortunately, and there's a lot of data and studies that are showing that many of the biases in the real world of health and medicine, and there are many biases in the real world of health and medicine, crossing over to the digital world through things like algorithms. The sad thing about that is it doesn't have to happen. There are many tools, there are many processes that allow us to essentially stress test anything like an algorithm getting put into use that impacts citizens and health consumers. The question that I often pose is, I've been in situations where, in their enthusiasm and with their good intent, there's an organization, there's a team that has spun up something like an algorithm, and they're putting it out in the wild. And when you ask the simple, and it's even doing good, and producing measurable positive benefits. But if I ask the question of, did you stress test that for bias? And I get that, what? Look, that says a lot about the intent's good, but in the race to do good, you can be doing harm. And a quick example would be, so all of a sudden, we're now the team, we're putting together an algorithm for a major medical center, where what we want to do is, for the 100 patients we took in today as inpatients, we want to risk rate follow them to figure out which one of those patients were at a high risk of having a random, unexpected adverse event. So, the idea is that there's someone that looks like they're going through the normal process, and all of a sudden, almost randomly, without notice, something happens. The code team comes in, they get them stabilized, and now instead of going home tomorrow, they're in ICU for a week. So how do we get out ahead of things like that? So we put an algorithm together. We've done a pilot among some patients, and we're able to predict which patients were going to have an adverse event. Not only predict, but reduce adverse events by 40%. So that's a win. As inequality-wise, we've reduced preventable adverse events by 40%. Economically, if you're in America and that's a fixed-pay patient by DRG, it's an economic win. What's important to recognize is 40% reduction is a statistical average. So it's producing measurable good, but it's 3 times better at predicting and preventing adverse events in white males versus Hispanic females. And oh, by the way, it's legal, it's compliant with all regulations, but is that okay? And I have my answer, but in a court of law, it's legal. The regulators would say it's fine. But these are the things that are happening every day. These are the things that, again, we can stress test. Bias, basically, in an algorithm or in AI, technically speaking, is just statistical variance in how it performs across the patient population you're using it on. So, one of the things, anyone listening in a healthcare organization today, I would say, if you're using AI, do you have a set of responsible AI principles that your leadership up to the board level have adopted? Yes or no? If you have, good for you. Are those responsible AI principles being applied each time you're using or bringing in an instance of AI and using it with your patients, your consumers, or with your employees? And when we get it down to that, I mean, everyone loves talking about responsible AI. But there are many talking about responsible AI that are likely causing harm because they haven't done the right things when it comes to having a set of principles, having a set of guidelines they are using. So it's a big conversation. And again, we're all early in the journey, but it's important. This gets back to the leadership imperative. Have you taken those steps so that if you're saying you want to be a leader in AI, you're not only leading, but you're leading responsibly, which means every patient, every citizen you're touching benefits equally from the use of AI versus some patients benefiting from AI and others being marginalized.
I agree. There's so much conversation with that in the future. I'm very interested to see how it goes, because I feel like we're just, like you said, just on the cusp, just in the beginning of like, how is this actually going to be equal for everyone? It's such a comment for conversation right now. So I'm going to stay tuned for a couple of years to see how it plays out, because honestly, I don't think we really have an answer to that at this moment in time. So, okay, so I want to ask this as like a personal question for yourself. So as you having done this, if you were to give a piece of advice to somebody that's looking to adopt AI into their practice, their hospital, or something like that, what would be your biggest, biggest, biggest little piece of wisdom?
Well, it'll probably be a summary of a lot of what we've been talking about. One, AI is a technology and it's a tool. It enables change. It doesn't drive change. Two, if you're any type of knowledge worker and you're reading the things or hearing about the things of how it impacts work, and I believe AI is the single greatest factor when it comes to the future of work for clinicians and healthcare. And so the question is, you can choose to be driving home or taking the bus home and being fearful of it and wringing your hands and worried about it, or you can choose to say, how do I step up and step into this? Because done right, I believe most knowledge workers who start doing a few things to know their work's going to change will actually end up being better off when it comes to their skill set, their ability to grow a great career, and frankly, the ability to do more of the things that when they decided to become a nurse, they actually are better at the things they care about. And again, that brings me back to what's the culture of the organization you're working in? Is your organization, do they get that this is huge on impact of work? I often have conversations where simple question is AI part of your HR plan? And again, when I pose that to leaders and I get that, what? That tells me that there's work to be done. But again, just think about it. So many of these things when it comes to value at scale down to that individual level is really about good leadership. And when you have that, magic happens. And when you don't have it, AI will eventually take hold. We'll figure it out, but it's going to be a longer, more painful ride when leaders don't get it versus when they do.
So yeah, it seems like you definitely take a pretty realistic and clear-headed view of the industry. Despite all the hype. I mean, especially being in it, kind of from the beginning in this healthcare space. So, what is there actually, that does deserve the hype? I guess I can ask. Is there any success stories where AI has significantly impacted healthcare or patient care in a way that actually is worthy of sort of the frenzy that actually did happen? Or because I heard you mention it a few times that we're still early, but what has been like these kind of peak moments that are like, yeah, this is what it can do.
Yeah, no, I have lots of stories. I don't know if anything justifies the hype we've seen. It's just, walk through any major health IT conference like HIMSS or medical conference in the exhibit hall where everyone's there to sell you stuff. And I would defy you to find any vendor in an exhibit hall that isn't talking about AI and whether they're using it or not. And there's some interesting studies that show that many organizations that say they're using AI actually aren't, but it's a great sales tool. So as far as there's lots of great examples emerging. I was just looking at, I just did a keynote for the American Optometry Association's national meeting, great meeting in Nashville. And so when we start looking at things like eye care, it was probably 12, 13 years ago, I was privileged to work with some brilliant data scientists and ophthalmologists on one of the first experiments to use vision AI to essentially take a picture of the back of the eye and the retina and being able to do things like diagnose or predict the propensity of diabetic retinopathy, the largest cause of blindness in the world. And so that was a major breakthrough and involved some pretty sophisticated cameras and things. Well, fast forward, we're now at a point where that's become mainstream. But what's interesting is work out of Harvard, some work out of London right now are showing that when you look at a retinal image, we can not only predict things like diabetic retinopathy, but based on the patterns of the retinal layers, we're now able to start predicting things like your propensity or risk for cardiovascular disease, neurological conditions. And so we're seeing basically what a colleague of mine calls machine eyes, things we're seeing that humans previously couldn't see in the same data, in the same images we've been looking at. And the same is true for, a chest x-ray is the most common image done around the world. And we're seeing similar things where the ability to do things like predict things like diabetes off of a chest x-ray. So we're continuing to see that. But back to diabetic retinopathy, in May of 2 months ago, the FDA here in America just approved AI that can be used to predict diabetic retinopathy basically in any handheld camera. So we've gone from this major thing 12 years ago to I believe we're already living in what I call the planet of the apps, where everything's an app on your smartphone. So with what the FDA just did, stay tuned. I predict that they'll, in the not too distant future, be an app on your phone that any consumer can take a picture of your eye and learn all kinds of things, including your propensity for eye health, your propensity for other things. Which, if I'm right, and you're an ophthalmologist or an optometrist, you should be thinking about how is that going to impact my current practice, the practice of care. And you can either be afraid of it, or you can be looking at, well, if I were an ophthalmologist or an optometrist and I could somehow get into the slipstream of apps with very high volume around the world on a smartphone. I mean, you can be afraid of that, or you can figure out, well, how's that going to integrate into the practice of medicine? Because we're still going to need optometrists, we're still going to need ophthalmologists. And then another story quickly. I'm heading to Singapore in 2 weeks. I love the work being done in Singapore. So Singapore has the largest problem with diabetes of any country in Asia. Their government literally declared war on it a couple of years ago, and they're using, back to, planet of the apps. So they're using AI and what's known as nudge theory, where they've identified a group of citizens who are pre-diabetic, and they're trying to work to slow the progression from pre-diabetic to diabetic. They're using AI and what's known as nudge theory, where the citizens who are part of this experiment are monitored. All kinds of data on them come together. And then several times a day, they get these highly personalized nudges to try and move them in the right direction. So the study is showing that, for those receiving these nudges, they're saying things like a 50% increase in physical activity, a large increase in steps, which not only helps slows the progression of diabetes, but think about it, starts slowing the progression of many other things when it comes to chronic conditions. So if we can do this to help slow the progression of diabetes, what are all the other things that the application of AI and nudge theory can help not only improve health, but have data that can be streaming back to clinicians, but equally important, having those consumers who want to be part of their own routine of being healthy, engaging them in ways that are meaningful for them, that are producing benefits not only for them, but across the population of diabetics or anyone else with a chronic condition. So a lot of this is in the hands of people done right. It's not only improving healthcare, it's getting people to think differently about their approach to health. Where, so many times we hear about diabetes, which is a huge problem everywhere. But we talk about it's like, once you have diabetes, how do we help you manage it? No, it's like, let's go upstream to say, what if we can actually slow the progression of diabetes? What if we can help? I mean, so many things, and you know this with the work you do, so much of what happens in the world has to do with conditions, disease that's preventable. So what if we can not only start, I mean, let's get better at the thing when people are sick, let's get better at how we manage that. But let's start going upstream to say, what if we can slow the progression of diabetes, improve health proactively rather than waiting for you to get, ill or sick, and then we're going to use AI. So to me, it's like, I'm looking for all of those people who are kind of the misfits, who are thinking differently, to say, with AI, we can actually not only make healthcare better, we can change what we're doing.
Tom, I think you like segued into the final portion of our podcast so well, because almost every single one that we do, we end up at the very end talking about preventative healthcare, basically, and how that is really the direction that the world needs to go in order for things to improve, people to benefit from stuff, because treating the symptoms is not necessarily as beneficial as getting rid of the underlying causes or preventing them prior. So, way to go. It's like you knew that we were almost done right now. So I guess Jasmine might have another question for this, but I had a question since you were talking about innovative apps with the retinal and everything like that. So there's a few of them right now that in the planet of the apps that you can just have it do a facial scan and it'll tell you whether or not what's wrong with you, essentially. Wanted to hear your thoughts on if that's legit, if it's a scam, or if you think that that's actually going to be feasible in the future to be accurate.
Yeah, well, again, multiple questions. My short answer is some of it's real, and some of it today is a scam. And which brings us back to that responsible AI and consumers beware. So again, when I look at the technology, when I look at the capabilities we have the ability to do things like the retinal scan and have that aid in predicting many things, not just eye health. And there's a company that I was just in Dublin working and talking with called iKey, where they've actually gone to the next level. Instead of the retina, they're looking at changes in patterns in the optic nerve, which gets us to things like predicting and preventing. I mean, usually today, by the time you have something that shows you've got macular degeneration happening, you've already compromised a high percentage of your eyesight. Well, imagine, our ability to keep any of that from happening. So we can do things like the retinal images. There are a number of things that are already out there in consumer apps that allow us to do things like take an image of a skin lesion and have some guidance on whether that's something to be concerned about. Yeah, so there are many things we're doing where vision APIs and other things allow us to take a picture of your face or voice biomarkers where I can take a 30-second snippet of you talking about anything and risk rate your propensity for Alzheimer's, for whether you're depressed now or you have a risk of depression. So the technology's there. Curated properly, it is going to do a lot of what you're talking about. But that's back to the done right of is it clinically efficacious? If it is, how is it deployed in a way that protects and preserves the right of every patient and citizen? And how do we how do we use AI to increase consumer engagement in ways that are appropriate? Because the ability to use a smart app to say, "Oh, I must have a brain tumor." I mean, I'm using an extreme now, but the idea is it's going to change the way health and medicine works. But we're still going to need those highly trained professionals. We're still going to need the medical centers to do all those things. But it's more a matter of how it's shifting. Again, the way health and medicine is done. We've got to have some guardrails on it. And we also have to have the ability to step on the gas because done right, it's truly going to improve the way we do things compared to the way
Yeah, I
we're
think
doing things today.
there's definitely like this necessary synergy between patient or user engagement with their own data, and then the AI enhancement, and then that connecting with the professional who's actually trained to interpret this and kind of see a more full picture. And it was very like you mentioned, the nudge theory that's kind of integral to our app as well. For the longevity app, it's like highlighting micro practices to be able to improve health span, and also micro learning and gamification strategies as well to encourage these behaviors ongoing, and that engagement to actually understand more what's actually happening in your bodies and with the aging process and all that kind of thing. So it's not just some nebulous concept that's kind of floating above you, but that it's something that you can actually relate to. And yeah, I think that's going to be a key too, and with the conversation.
Jasmine, you keep talking. I should be interviewing you on the good work you're doing.
But I guess so the we can with the last question we do like a little bit of futurism. Um, I mean, so maybe we can talk about in the next decade, but maybe even if you have some wild speculations, like how do you see the role of AI evolving in the healthcare sector, at its greatest level? Like, when we do have great data and, applied the right way, like what is the sky the limit, or how do you see that playing out?
Yeah, boy, that's a big one to swing at. So, I'm parsing. I guess a couple of things. One, um, it's interesting to me as I travel the world how many times I hear healthcare people say, "We provide personalized care," and when I hear that, in my mind, what's really going through it is, no, you don't. I mean, we, you can provide good care and clinically efficacious care, but we pretty much treat all patients the same way when they have a condition or they they need help. And I see that changing with AI. I think when you think about the concept of best practices, which is a data driven approach to say, when there's something that is a condition and you have treatment options, what does the data and history show that is the best decision to make to do? And we've done that historically because we haven't had the data, we haven't had the tools to be any better. But imagine a time where we've got massive amounts of data, all the data we have now, the genetic data, all of the omics data we have on you, all of the social determinants of health, which have huge impact on your health and the direction of your health. And we could bring that together in a way that's simple and easy to have that personalize at an extreme level what we should be doing for you, Melissa, versus you, Jasmine, even though you have the exact same condition. So I think that's coming. I mean, we already hear and talk about a lot about precision medicine. I think that's actually going to come to pass at a much higher degree than what we see now. The second thing, which has nothing to do with AI, and I'll use America as an example simply because that's where I'm from. But I've had the privilege of working with health systems around the world. Some are better than others. I've never found a country that has it all figured out. And my challenge, and particularly here in the United States, is this: everyone's talking about AI, and again, we need to squeeze the hype out, but it is going to lead us to great things, greater things. But you know, we have to rise above what AI is going to do and start looking at things like America has, for the most part, a break fix model. 97% of all money, and we spent $4.5 trillion the last time we counted on healthcare. Only 3% of that $4.5 trillion went to preventive services. The rest, it's like we are the best. When you get that bad diagnosis, we are among the best if you're well insured to take care of you. So somehow, AI, without changing the model in which health operates under, which is mainly break fix, we're going to make the break fix model much more efficient and effective. But I don't think that's where we want to go. Where we want to go is that health and well-being and longevity and closing the gap between lifespan and health span, which is so much more than getting better at fixing you when you have a diagnosis. So we need to keep pushing on AI, but we need to also start looking at, well, what are all the ways in which we can use AI, the massive amounts of data we have, to start reimagining and redeploying assets to say, well, let's use AI as a tool, a lever, to start doing much more on the preventive, on the proactive health management, on the things that I believe consumers want. I believe most practitioners would love to be, expanding what they do rather than just doing, so many cases a day and what they see. So I think it's going to make medicine far more personal and effective. And I think if we can change the dynamics of the break fix model to truly be pursuing things like, the hot topic now is value based care, which is to say, what if all of a sudden people would make more money by managing you to be healthy rather than just fixing you when you're not? So one has everything to do with where AI is going to take us. The other is AI is either going to make the current system more efficient, though I still don't believe it's sustainable. But changing that model, all of a sudden, we've got this whole new revolution that AI is going to help drive.
I love it. I can't wait to see what happens. I think, as you said, no healthcare system around the world is perfect right now. So there's so much opportunity for positive change to be enacted by everyone around here. So here's hoping. All right, Tom, we have to wrap up. Thank you so much for joining us today. Was really excited about this. I know we've met a couple of times, but to be able to sit down and really pick your brain on things has been really wonderful.
Well, yeah, I think the last time I think I saw you in Washington D.C. Otherwise, I think the last time I saw you, Jasmine, we were on a panel together in Dublin. But yeah, hopefully, I don't know where we'll see each other next. But thank you for having me on, and also you guys are doing great work. Keep it up. I mean, changing healthcare is a collective effort, and it involves all of us. So anyway, I appreciate you taking the
Yeah.
time
Thank you for joining us.
to do this with me.
All right. See you guys next time on our next and final episode from this season.